Hello, everyone. Thank you so much for hopping in. It's another day. My name is Ransom Nyema. If you don't know me, I'm a Nigerian. I'm based in Nigeria, and apart from my medical studies, like you all know that I'm a medical student. But if you don't know me, I'm a third year medical student, and apart from medical education, I'm also a proficient freelance content writer, and I do a whole lot of writings on medical articles, blog content, professional newsletters, social media medical content, and others. I work with pharmaceutical healthcare companies, and also I work with personal clients out there. So today's an amazing talk. So I have an amazing guest speaker. Hey, Elizabeth, could you introduce yourself to the audience?
Hi, I'm Elizabeth Ross. I'm a Veriditas certified Labyrinth facilitator, certified sound therapist, and generally overall complementary therapy, holistic health practitioner, storyteller, scholar, diverse background.
I love the fact that you're a therapist. People need a therapist in their various lives, right?
So I'm not a therapist in the same way that like a psychotherapist is. So what I do with sound therapy is
Mhm.
um, it's more like complementary therapy. It's yes, treating the person, but treating them holistically. And it's not a talk therapy thing. It's it's collaborative, but it's more of a passive reception on the part of the client. So um, what I do primarily, what I really enjoy doing most, is the sound baths. So you would sort of lie in a relaxed position and just let the sound kind of wash over you, and through that, you can end up doing a fair bit of actual emotional processing in that process as well. But the only thing that I sort of sell on that is relaxation. So
That's amazing. That's amazing. Thank you so much for explaining that first, Mrs. Elizabeth. So, are you ready for these questions I have for you, Elizabeth?
let's give it a go.
Are you sure?
I'm sure.
All right. So, the first question. So, I want to put a disclaimer out there. If I'm looking downwards, I'm reading the questions to her. All right. So, the first question goes this way. Hmm, hmm, hmm. Are you sure you're ready for this question, Elizabeth?
I'm ready.
Okay. So, can you share, a bit about your journey, to becoming a complementary therapist, and scholar, you know? So, and how storytelling plays a vital role in your practices. So, tell us how that works for you.
So, my mother will tell you that I've been on this path since I was 2 years old. When I asked her how my grandmother could be in the ground and in heaven at the same time, she explained the concept of soul to me, and I was quite content with that answer. Um, so, but I've been asking questions of a spiritual nature my whole life. I grew up in Newfoundland, which is a fairly small place, and it's still very much steeped in the church. Certainly, it was when I was growing up in the 80s and 90s. And, it was very unusual that my family actually encouraged um, exploration in different religions and different spiritual paths. My grandfather was self-professed agnostic, had never even been baptized, and my grandmother was staunch Church of England, Anglican Church. So we kind of had the leeway within that all the way through. I was exposed to the Baha'i community in St. John's briefly as a child, which helped shape my ideas. And then I encountered paganism, Wicca, Druidry, that sort of thing, the Reconstructionist religions in sort of junior high school. So by the time I got to university, I ended up falling into the religious studies department and deciding these were my people, and I never left. So I did my undergraduate degree in religious studies and medieval studies, and I did my master's degree as well in religious studies. So I had a very academic interest in religion and spirituality. But I grew up in the household of a professor of medical ethics. So my grandfather would ask us all these questions and teach us about all these different perspectives, because he actually spent half of his time in Africa when I was a child. He was setting up a postgraduate medical training facility in Uganda. So we had very interesting global perspectives. We had all kinds of conversations about different things. And we talked about not just the actual medicine side of things and the science side of things, but then the social implications, and discussing things like colonialism over the dinner table. This was not a normal upbringing for a kid in Newfoundland in the 80s and 90s. So I never lost that. I always wanted to balance, what does the science say with what do the social sciences say? What do the humanities say? He always talked about treating people and not as a disease. So that has informed everything I've done. And when I was in grad school in religious studies, and I was presenting my own research at a religious studies conference, there was another project that was being presented based on spiritual care in end of life. And what they were presenting was that in addition to the information that they had gone in looking for, which was how do you define a good death in the different religious traditions, the more interesting story for them came out that there was this rising trend towards people identifying as spiritual but not religious, and that their needs weren't being met by chaplaincy, and oftentimes it was devolving on the nurses. So you have this complex relationship between real spiritual needs and the institution of medicine, and how do you balance that for the benefit of the patient? I have a fairly omnist perspective in my own beliefs. So that means that I see some truth in all religions. And I don't think any of us have managed to figure out the one true way. And I find that religion and spirituality serves a purpose well beyond just giving you a framework. It answers the questions of why, whereas science generally can only explain how. So we understand how the body works physically, but in terms of why we experience certain emotions and things like that, that's getting more into the numinous and the things that we can't give a definitive answer to. So when I finished grad school and I wasn't ready to continue on to a PhD, I started kind of bouncing around and doing different things. I was a historical interpreter my entire adult life, side jobs while I was in school and things like that. So I started to sort of incorporate the storytelling into my worldview a little bit more explicitly. And that kind of informed how I continued until eventually I kind of got to the point where it's like, I'm not going to find the answers I'm looking for in an educational institution. And I did try going to nursing so that I could try and pursue these research questions in that vein. But I realized very quickly that I was doing nursing as a means to an end, not an end in itself. And that was really prohibiting me progressing. It was a little bit too stressful for me. And that's about the time that I discovered the Labyrinth. And then from there into Labyrinth facilitation and adding other complementary therapies on top of that. So very long and winding path.
Absolutely. That was so sensational. Thank you so much for sharing your journey with us. That was so emotional. Thank you so much. Mm. So, something I learned from your your talks was like you did you initially, before I ask that question, did you initially had interest in religious studies during your undergraduate studies? Did you want to study religious studies initially?
So when I went into university, I kind of had, the normal societal pressures of like, do something practical. I think I had initially wanted to do music.
Really?
So And then I didn't get into music school. Got to the wait list, so at least I knew I was qualified. It's just it was very competitive. Couple of years. That was the year that they had the double cohort in Ontario, so we ended up with too many applicants, not enough spaces, kind of thing. So I had to kind of rethink things, and I started thinking about languages and sort of what can I do that will practically give me a job, which is not how you need to think about an arts degree. Not unless you have a very specific purpose in mind. And it was sort of trying to figure all that out. That, like I said, I realized that the one place that I was happiest was in religious studies. And it was around that time that my professors started telling me, hey, by the way, you might actually have a career in academia right now, because, there's a lot of us retiring soon. I'm not going to get into the whole thing of what academia actually turned out to be, but it's my love. It's my passion. I love learning. I love research. I love connecting ideas. So it was a really good home for me. And, people ask me now, so when are you doing your PhD? And they're joking. It's coming. I don't know when, but for now, I'm happier being boots on the ground. And I want to see how I can pursue what I'm doing in a way that I can actually make a difference, and that I can make it rooted in the community and make it grassroots, instead of just being something that, I turn out a thesis that will get published in a journal and never read again.
Amazing. Hey, Elizabeth, I love your determination, right, to get to your goals, and that's really amazing thing. So, is it only Uganda that your dad was doing those kind of medical practices in Africa?
Yeah. So his name was Dr. John Ross. He had actually grown up in Kenya. He was born in Kisumu. His parents were in the British colonial service. His father was a doctor, mother was a missionary, and that was where they met and married. So he had a happy childhood in Africa, and he went on to study in Australia and then in Scotland. His family were from Scotland, and then eventually he ended up in the outports in Newfoundland. And he decided towards the end of his career, once he was in the medical school at Memorial, that he wanted to give back to Africa for his happy childhood. And he didn't want to do it in the same way that, the white savior complex, going in and just, we're going to solve your problems for you. So he worked with Makara University, I think. I can't remember the name of it, but it was in Choro, and they were working on a residency type postgraduate medical training. So he helped the university to get it running, got some funding from Industry Canada, and did some fundraising back in Canada to get supplies and things like that. And from what I understand, that training facility is still going today. So, but the idea was that he was helping bring the expertise and the funding and the supplies from Canada to help them get established, but become self-sufficient. So, and that's, as far as I understand, what has actually happened in the intervening 20 years. It was the 90s when he finished that up. So,
wow.
Yeah, I grew up with all these beautiful stories and incredible photos, and
amazing. Yeah. That's cool. Your grandfather did an amazing job, especially in Africa, because we in Africa need those kind of works, because Africa needs those kind of people like a grandfather to do those setups in these countries in Africa. But I was wondering why he only settled in Uganda. He could have come over to Nigeria as well.
Well, I mean, he did still have family in Newfoundland, and he still very much loved it there. So it was a 5-year project. He only really had it in him to do one at that point, because he was semi-retired at that point. And when he went back to Newfoundland, he actually did end up continuing to travel. He went to Australia to do a year of relief work in the outbacks, and then he was helping set up the nurse practitioner program in Newfoundland, because rural Newfoundland has similar challenges to rural areas anywhere. It's hard to get people to come in, it's hard to get them to stay. So The way you practice medicine in a rural area is very different to a big center where you've got hospital access and things like that. So he was helping to teach them how to be self-sufficient in an environment that med school does not prepare you for these
Hmm.
days.
Hmm.
And then he
Wow.
passed away in 1999. So, but I think he
Whoa, whoa.
probably would have loved to have done more. But yeah, that
Yeah.
was who he ended up
Yeah.
partnering with in that particular project. So,
Wow, that's crazy. That's really crazy that your grandfather did all this amazing stuff. He would have done more if he's still alive. And yeah, I do
mm-hmm.
believe in him. Thank you so much for sharing that with us. So you ready for the second question?
Mm-hmm.
So tell me, on a scale of 5, how ready are you for this question?
I think I'm pretty close to a 5.
Mm, 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 mm. All right. So
I did my
what?
homework.
Yeah, absolutely, absolutely, absolutely. So what inspired you to focus on? So before I tell you this question, talk us through a little bit in a nutshell about the lightning the way on your path.
So,
Back tell us more about that.
so illumination, light, that's all a very common theme that you'll find in mysticism, which was one of the things that I was very interested in religious studies. That's the direct experience of the divine, the numinous. It's the personal experience rather than the dogmatic trappings and the ritual and all of that. So, um, if you look back through the history of mysticism, there's always this recurring theme of light. Um, in medieval Christian mysticism, for example, they had the idea that the imago Dei is the soul. That's the part of God that is in humans and made in His image. And you can think of that as a light, and think about your own soul as a light that's like in a lantern, and the glass has gotten really dim. So when you're learning about yourself and doing the work on yourself that you need to do to be able to tap into that connection with God, it's like you're rubbing away the dirt on the lantern so that your light shines brighter. The light is always unchanged. It's the lantern on the outside that
Mm,
changes as
mm,
you uncover and sort of clean up your act, sort of thing, and do that work. So, and you'll even hear it in like new age conversations, be the light that you want to see in the world, things like that. And
mm,
that was something that when I was going through my own kind of dark night of the soul, people kept telling me was that, you need to shine the light. And that was the thing that sort of helped get me through, is that I was learning all these things by traveling and experiencing different ceremonies and different modalities of healing on a spiritual level, that I was able to bring that back to other people and help share that. I'm not looking to tell somebody what to believe or how to believe or how to practice. What I'm doing is I'm offering you the tools that help light my way so that you can find your own path. All I'm doing is holding a lantern to
mm,
help make the path clearer for you to figure it out for yourself. Because each of us ultimately, regardless of whether or not we belong to a religion that's millions strong or we just have our own personal beliefs, at the end of the day, your relationship with God, the divine, the numinous, whatever you believe in, is personal.
mm.
So your own journey is going to look different to mine. So that was the idea, was that I wanted to show that I'm helping you find the path, but
Wow.
you're still the one walking it.
So what really inspired you to focus on that? And what does that concept really mean to you?
Um, I mean, I've had spiritual teachers along the way who that's basically what they were doing. And it took time for me to see that, right? And it's very easy, especially when you're talking about complementary therapy and you get into more of the new age stuff. It's very easy to fall into these pitfalls of like following gurus or following, this is my 12-step practice or whatever step practice. And, you follow it rigidly through that practice. And that's the only way to do it. Whereas what I found helped me was just somebody asked me questions. I still had to answer them, but I was too close to be able to even get clarity on the question I needed to ask myself to be able to move forward. So I just wanted to be able to help people in a way that I had been helped, because I find it's very difficult to find that now with people turning away from institutional religion a lot. I mean, if you happen to be a member of a church and you've got a pastor that you've got a great relationship with, absolutely go seek your spiritual guidance there. I can help support that relationship if that's something that somebody's interested in. But there's been
Hmm.
so many people that are what is called church hurt, that have experienced negative things out of institutional religion. They still
Wow.
deserve to be able to find their own way.
Hmm.
Um, and maybe they're more comfortable with an individual who's not pushing a particular belief system. And that's still important work that needs to be done.
Amazing, amazing. That's wow, wow, wow. Wait, do you think your kind of work is needed in the medical field? Do you think?
Absolutely. Absolutely. The lady who introduced me to the Labyrinth was actually the head of pastoral care at a mental health facility in St. John's. And she was explaining to me that where they've adopted more of a spiritual model rather than the traditional, each religion providing their own chaplain, um, and everybody's kind of working on the same practices. So it's more about having the right practices to answer your own questions, instead of dictating this is how a particular religious view would answer that question. Um, they have something like 97% uptake on pastoral care services,
Hmm.
whereas the other hospitals in the area, where it is still that traditional chaplaincy of each religion provides their own chaplain, it's only around 40% uptake.
Hmm.
But everybody has spiritual needs. And especially when you're talking about in medicine, you're dealing with people's most intimate, scary, private things. And you need somebody to be able to support you through that. And like I said, what that study that inspired me in my master's degree had found was that a lot of time that's devolving on the nurses. And that was something that came up a lot in my nursing education. Doctors are way too busy to be dealing with people's emotional and spiritual needs most of the time.
Absolutely.
Everybody's overworked in the system. Nurses are too overworked, but they're the ones who are there every day. And if you're in there interacting with somebody several times a day, they form a relationship with you, and they're going to start, spinning what needs to come out of their head if they need to talk about it. And sometimes the nurses aren't equipped because they just aren't getting the right training in spiritual care. Um, and like I said, everybody's overworked. We all know everybody's got too much of a caseload. So, absolutely. And in particular, the Labyrinth has done very well in medical settings. Um, I actually saw one that was painted on the concrete at the entrance of a hospital.
Hmm.
And what you'll find is that, like, you'll see doctors in scrubs, because what better way if you've just had a surgery that's been really stressful and maybe hasn't gone the way you wanted it to. If you can go outside and take 5 minutes to do something that's going to help you decompress, even from
Hmm.
that side of things, they're going to be better and more focused to go back in and do the next one. If you're too busy to take, an hour out of your day for a meditative practice, the Labyrinth, especially if it's a smaller scale, is something that can help you just get centered to be able to keep moving. And yeah, everybody from the staff to the patients and the families are all asking questions in this situation. And a lot of times there aren't firm answers. And that's where spirituality has to start picking up the other side of it and helping to take care of the whole patient so that we can improve outcomes.
Wow. Wow, wow, wow. I love the statement you made about doctors are really too busy to focus on your emotional aspect of your life and other spiritualities around you, and which is really acceptable. I do agree. And this is the reason why your kind of work is really needed, because there are people that are really confused with the things that are moving in their lives. They don't really know where they're actually moving. Are they moving forward or are they moving backwards, right? So the kind of works you do, try to like illuminate their path, give them a sense of vigor, that they can actually do this. And this is amazing. That's very amazing. Thank you so much for sharing that with us. So are you ready for the question?
Yep, let's do this.
All right. So how do you integrate, right, different therapeutic modalities, right, into your practice to help individuals reconnect with themselves? Whoa, what do you have to say about that?
Um, I mean, that's a very big question. There's a lot of ground to cover. Um, and I was
That's all.
thinking about, how best to present this. I'm very uh, firm believer in, you know evidence-based model. And while there's all kinds of beliefs about what may or may not be happening with something like sound therapy, um, the simplest answer is that it's physics, and it helps the body in a holistic way. So when I say that, what I mean is, um, it's become very popular in therapeutic circles to talk about the nervous system, the somatic exercises, or talking about the vagus nerve, and your fight or flight versus rest and digest. So looking from the pathophysiological side of things, if we know from trauma research that um, if somebody is either they've experienced one major trauma that has put their body into this fight or flight mode, or they've experienced repeated traumas that do this time and time again, or just high stress, it sets your body into that autonomic response where you're getting a lot of adrenaline and then cortisol as it starts to calm down. And we know that this all compounds things like inflammation, and makes it harder for the body to heal itself. So these are all things that we know from the pathophysiology. So anything that can help you get to a state of relaxation is going to help improve the body's ability to heal itself, because you're getting away from that fight or flight. The more repetitively you can do this, the more you can maintain a sustained practice, the easier it is for your body to repair itself. And something like labyrinth walking ties into the somatic nervous system, the part of the nervous system that we have control over. We do actions and we engage in activities that will show the body from the conscious to the unconscious how to relax. So when you're walking a labyrinth, you use that movement to focus on your body and feel into your body until you get to that relaxation state, you get to that receptive state. If that's not something that you can do consciously, if you're not comfortable with being alone with your own thoughts yet, even just taking an hour or a half hour to do a sound bath, or the one-on-one treatment, can help with things like lowering your heart rate. And we know that this has benefits from the obvious, if you've actually got a heart condition, but right the way through to things like diabetes is actually being suggested for treatment with sound therapy in certain places now. So I'm not going to make claims that I can cure any of these things, but what I can do as a complementary therapist is something that complements all the things that you're doing for your health, is to help find ways to reduce the stress, to keep your body calmer, to get yourself into that state where you're lowering those levels of the biochemicals that make it harder for your body to heal.
Wow, wow, Elizabeth, that was really really amazing. Thank you so much for sharing that with us. Could you tell us more about, in quote, what sound therapy is all about and how it can be used in the medical aspect in a nutshell, for people that will come across this video and be like, what is sound therapy? What does that mean? Could you tell us what that means?
So you're dealing mostly with the vibrations of sound in this instance. We know physics tells us vibrations have an impact on the body, and you're starting to see more research into this, um, in terms of, are there certain vibrational frequencies that can help shift things physically within the body. Um, so that's part of it. The other side of it is straight up music theory. A lot of people in sound therapy actually don't have a strong music background because it's very accessible to be able to just, listen to the sound bowls or the drum and understand how that affects your emotions on a very intuitive level. But when you add that theoretical background, we know that if you have two notes that are too close together, it forms a sort of dissonant sound and it's uncomfortable. If you can guide somebody through a process where you are intentionally creating that dissonance and then helping it resolve into something gentle, then you're helping them have that emotional experience. You think about the music that appeals to you at different times. When you're happy, you want something upbeat. When you're sad, you want something that's going to help you feel that sadness and feel into it and help you express it in a way that maybe you don't have words for. So in the same way, sound therapy can help you do that in a controlled and concentrated way that's tailored specifically for you and what's going on with you in that moment.
Wow. 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 Sound therapy is really needed in the medical aspect. Absolutely. Absolutely. When you talk about sound therapy, it sounds like what profession does it sound like to me? I'm sorry, I can't remember. It's
Now, it is different.
related to
It
it's
is different
related
from music therapy. So music therapy, usually the music therapist would have a background in psychology, and I
yeah.
don't have that. Full disclaimer, I'm not a therapist in that sense. I don't have, I mean, I have studied my own brain and sort of the things that go on with myself. For example, I'm a big advocate for ADHD because understanding the ways in which that impacts how I think and how I experience emotions has been one of the most illuminating things I've ever experienced. Just that understanding changes how I approach things. And I think that's very important. And from that point of view, I've looked into my own things and sort of, I know a little bit about the psychology, but as a hobbyist, that's personal interest. I don't have formal training. Um, but with music therapy, that's where they come from. They've got that background in psychology and they explicitly use music therapy in terms of like teaching people how to use an instrument in a way that works almost like occupational therapy. It's like a subset of occupational therapy, um, similar to art therapy, that sort of thing. So what I do is different. I'm taking different forms of sound, particularly ones that are really good for the vibration. So like you can see my hand drum behind me here on the mantle. Um, the vibrations of a hand drum can have an amazing relaxing effect. And even if it's not relaxing, it can still the way that you change the beat can uh, evoke a different emotion. Again,
Hmm.
something faster is going to make you kind of more tense. Something slower is going to help you relax. You will naturally start to set the rhythm of your breathing and your heart rate to the rhythm of a drum beat. Um, we also use more one-on-one. I use tuning forks as well, where you can't necessarily hear the vibration, but you can place it on a particular body part if there's um, pain or injury or something like that. Again, you do have to be careful because there's certain conditions that you don't want to be treating with this stuff.
Yeah.
Pacemakers are the really obvious one. You don't want to do anything that could potentially interact with that. Nobody wants to touch pregnant women. um, you know so there are some contraindications for it, but yeah, it's just different vibrational instruments. Sound bowls is another big one that people use, particularly the crystal ones, because that sound travels very, very well and it's got a very interesting quality to it.
Hmm. 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 That was so deep. Hmm. Thank you so much for sharing that, Elizabeth. So we have four more questions to go.
Hmm.
Mm, mm, mm. You've been an amazing, great speaker, Elizabeth, and
Thank you.
thank you so much for sharing your insights. And these are amazing insights you're sharing thus far. So the fourth question goes this way. So could you share a memorable? Are you ready for this question?
Hmm.
Mm, mm. Could you share a memorable story from your experience, right? Working with clients, right? That illustrates the power of self discovery and healing. So, what do you have to share about that?
So, one of my favorite stories so far actually came from my very first retreat that I held in Texas with one of my partners, actually a couple of my partners who I've worked with a couple of times now, Gina Snooks, who's a photography and uh, photographer and feminist scholar, and Natasha Morisawa, who's a licensed psychotherapist in California. Um, so we incorporated things for embodied practice. So we were looking at, we incorporated the labyrinth. We were talking about the different ways that we present ourselves and how we can play with those stories in creative ways. So it is the storytelling aspect. People are meaning makers, and explaining to somebody that you can change your story however you want, and that can have a real impact on how you experience it. Um, and so we went through some of these creative exercises to help people kind of just think about it differently. And I did do a little bit of one-on-one sound therapy treatment. And about halfway through the retreat, a lady who I've known for a number of years, she had actually been one of my early spiritual teachers. Um, she had just returned to music after several years of kind of not really taking it seriously, but in retirement, she's been able to go back and do more with it. And she has been kind of a little bit blocked, or had been at the time. And during one of the creative exercises, she sat down and she just boom, song right there. And so she was actually able to sing this beautiful song about empowerment and what have you, that she had just spontaneously written, because creating the space at this retreat and going through these practices and doing that little bit of self-reflection, getting her body moving within those creative practices, helped her tap into that creative font again. And she was able to tell a story, a beautiful story of empowerment that had been elusive for some time. So that's a really dramatic effect. Um,
Mm,
but that's the kind of thing that we're looking to help people create, is, figure out what works for you
yeah.
to be able to do the work yourself
Mm,
and, have a better experience of your everyday.
mm, mm. Wow. Thank you so much, Elizabeth, for sharing that with us. I believe that the audience would greatly appreciate you for that. So we have the fifth question. You ready?
Mhm.
So I want to know something. I want to know something. You know, as a medical student, I know music therapy is highly needed in our society amongst medical students, or amongst medical professionals out there. There's some music. I love listening to music. I love music, man. I don't listen. I don't like hip hop songs. Like, I don't like hip hop songs. I love R&B songs. I love Afrobeats. And others, right? And yeah, there are times that you feel so depressed or so tired, or you don't even know. You can't even think properly. There's some music you just listen to. You get your courage back, and yeah, it's really really needed. A little advice for the medical students out there is, once you're feeling so stressed out, depressed, burned out, I've been there, and Sometimes I'm just working on myself and just try to listen to some music, some amazing music for you to, get acquainted back to your spirit, and it's really needed. Thank you so much for doing that for us. And Elizabeth, that's why I really admire your work, because it's really versatile. It can apply to all systems in the medical, in all kind of field, entrepreneur, in all kind of field. So kudos to you for the kind of work you do. So the fifth question goes this way. You ready?
Mm-hmm.
So in today's fast-paced world, right, how can individuals carve out time or create out time for self-reflection, right, and personal growth amidst their busy schedules? So what do you have to say about that?
I mean, we think about, you know, things like mindfulness. You think about meditation, you think about yoga, you think you're going to have to put aside at least an hour, and then there's transportation time if you're going to his yoga studio. It's not that complicated. It doesn't have to be. Again, I have ADHD, so I've had to be very conscious in how I build this into my everyday practice, because unless something is a really firmly established habit, I'm not going to do it. So to get myself started, and I've freely admit that, this is still a work in progress, even for myself. We're all really good at giving advice, less so at taking it. Uh, so there's different things. Journaling is a big one. And again, you don't have to sit down and write out your whole life story. I've got this mindfulness journal that I picked up at Costco, and it's just, all it is it's a quick snapshot, and it just asks you to check in the morning with how you woke up feeling, set an intention for the day, and the sorts of challenges that you've got expecting coming up ahead. And then at the end of the day, you just do a quick reflection on, what happened. Were you able to, be more conscious of how you're going through things, and how, what were your distractions? How's your mood? And a final thought for the day. Like, it doesn't have to be super complicated. This takes me like 5 minutes in the morning, 5 minutes at night. That's it. And to keep myself accountable for doing it, I have an app on my phone called Habitica, and it's a game. It's basically like a role-based or turn-based role-playing game, where every time that I check off one of my to-do list, I get points that get allocated to my little character, my little avatar. There's like games within it that you can play. And it doesn't even have to be that complicated, though. A checklist app helps. Having a physical checklist, if that helps you, that little shot of dopamine from checking off one of your to-do list will help enforce it as a habit. And that works regardless of whether or not you have ADHD, but it's particularly useful for those of us who have that added challenge. Practice with others. If you can set aside even like a video chat with a friend, to just, hey, we're going to meet here at this time so that we can hold ourselves accountable for doing our practice. I have a writing group that does that. We get on a Zoom call for 2 hours, and it's absolute silence while we're all working on our own writing projects separately. But it holds us accountable to actually making time for that. Investments. If you have the available funds, that sort of thing, if you pay for a class or something like that, especially if it's in person, again, that accountability, you are more likely to follow through. I'm not saying everybody needs to go out and pay a whole bunch of money, but like, if you're offered something for free, you might sign up for it but then not show up. But if you had to pay even £5, $5, whatever, to do that, to sign up for it, you're more likely to go because you've made the investment. So it's working with your own habits and knowing how to build that in, but it doesn't have to be super complicated. Even walking a labyrinth, I've got finger labyrinths here that, it's got the path. It takes just a few minutes to trace the path with your finger into the center and back out again. Reduce your barriers. So, put your gym clothes by the door. They tell you if you're trying to build a workout habit, same deal. If you want to build a mindfulness habit, or you want to build self-reflection, put your journal on your desk, wherever you're going to be working, whatever you're going to see it, put it somewhere where it's visible so you're thinking about it more often. And if you get 5 minutes, do 5 minutes. Biggest thing though, don't make it something that you have to do. Don't make it something that you're going to beat yourself up for if you don't do it.
Absolutely. Absolutely.
And this is, again, the things that I offer play into this as well. If you are scheduling a time to go to a private one-on-one session or scheduling a time to go to sound bath and you're paying for that, that helps you show up and be accountable to it. It also helps then that it's a positive experience that you look forward to. If you don't have time to
Mm,
do all of that, like I said, do the small stuff at home. I'm also starting to prepare for launching a new service on my website for spiritual coaching. So I can offer one-on-one sessions to just show up and help ask those questions and help you determine what your values are and figure out how to start working on your own self-reflection if you don't even know where to start. And that comes from, like I said, my religious studies background, where I've learned about all the different religious traditions, but then also my own work in finding what works for me and what doesn't. So,
mm, mm, mm. Wow. That was a lot. That was really a lot. Thank you so much for sharing that with us. That was so emotional. I really felt it, and I believe that the audience will really absolutely feel it. So we have two more questions to go. You ready?
mhm.
Wow. So what advice would you give to someone you know who feels lost, or disconnected, right, from themselves, and is seeking guidance to rediscover their inner light. So, what do you have to say about that?
um, Ask questions. That's the first step. Start asking yourself first, can you identify something that you think you are missing? Or is it too fuzzy to even get that far? Reach out. Uh, there's plenty of avenues, online as well as, in person. Look for community groups, connect with people. That's going to help you a lot. Um, but ask questions, do the research, start looking into it, and ask yourself, does this align with my values? And rather than looking for answers, look for the right questions. Um, Biggest thing though is connection. Never ever doubt the power of finding people that you connect with if you at all can. Um, Even an online community is better than none at all. Um, you do still need to take your own time and your own quiet and privacy to reflect, but if you're completely alone, that's not going to help your headspace. Um, One of the things that I found that actually helped me start moving out of that sort of trapped space when I was in a dark place um, was a challenge. 3 things you're grateful for every day. And it doesn't have to be anything big. Sometimes it was like the guy ahead of me bought me a Coke, like whatever, you know, somebody said something nice to me. That can be my grateful thing if I can't think of something bigger, but look for the things that you can identify as being positive, that are a good influence on you, and then write them down and be able to look back and reflect on that as to what's the pattern here, what are the things that I prioritize, what are my values, and from there then find the systems and the methods that help support the things that are important to you.
Mm, 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 mm. That was a great advice, Elizabeth, for people feeling so disconnected from themselves, and find a way to rediscover their light or something. So that was an amazing nugget. Thank you so much for that. So we've come to the last question. and you've been an amazing guest speaker, like I said before. So this is the last question. So I want to hear your perspective on this question for the audience to get more clarity on it. So in your own perspective, in a nutshell, how do you envision the future of complementary therapy and storytelling intersecting to promote mental health and emotional well-being on a broader scale? So what do you have to say about that?
Well, like I said, my interests in this area started from questions about how do we interact with institutions if we're not comfortable with traditional church-based or institutional religion-based um, spiritual care and pastoral care. Um, if you look at the mental health crisis we're looking at, I by no means would try and suggest that we should go back to the way things were with institutions that weren't accountable and that did cause harm. But there has been a decline in our mental health all on the whole at about the same pace that we are declining from church attendance and things like that. So, and it's not just the church itself. You think about the function that it plays in the community. This is where you met your neighbors. This is where you celebrated milestones. You marked every transition in your life. It was a place you could go to talk to somebody if you had a problem. um, it was a place that you went to just spend 5 minutes in contemplation. Well, probably closer to an hour and a half, let's be real. But so it served all of those things. And we don't have those things baked into our culture anymore. So if you go through your life and you don't mark transitions, if you have, for example, I mean, birth is a little bit different because we're moving more towards um, situations where, women are looking for more meaning and developing that meaning around the birthing experience. But prior to that, all you had was a sterile clinical experience. And, we've largely kept the tradition of christening and things like that, even when you don't necessarily still fall into that tradition, because that's an event. It's a ritual that takes place to mark the event. So I think that complementary therapy can help you develop tools that will help support in an institutional way or in a systematic way um, your mental health by means of connection, by means of meaning making. Like I said, storytelling, ultimately, that's what it is. Humans are meaning makers. And all of our mythology, all of our religious theology, it's all storytelling. And if you can create a narrative that's meaningful to you, that's going to help you move through this world with more peace, with a greater sense of accomplishment, with a sense of purpose, and all of those things will contribute to your mental and emotional well-being. Ideally, in an ideal world, I would love to see us transition to being able to have like community hubs or have this spiritual-based pastoral care, either in healthcare institutions or in the community, where we can find ways to create the roles of the church without necessarily everybody having to believe in the same thing, to be able to come together and support each other and to have that framework that helps create meaning and structure in our lives.
Whoa, that was great. Elizabeth, thank you so much. Um, we've come to the end of the session, and it was amazing to have you on as a guest speaker. Nevertheless, your tight schedule, you had to just hop in to tell the audience more about sound therapy and how it's very important in our daily lives, and that's really amazing, really really amazing. Thank you so much. And so, what are your last words for the audience before we wrap up this session?
Ask questions. Never stop asking questions. And don't be afraid to create your own meaning.
Absolutely. So, if you love this content, do well to subscribe, like, comment, and share to your network as well. And wait for my upcoming content. Thank you so much.